Awesome. Thank you for the great introduction. My name is Ritish. This is Brandon, and we're from Luso Labs. And today we're going to talk to you about an initiative called CERVICAL, which is looking to provide affordable, accurate, and accessible cervical cancer screening for millions of women around the world. Cervical cancer continues to devastate women in India, where a lack of vaccinations and inadequate screening methods leads to 160,000 new cases and 100,000 deaths every single year. As a result of this, the cervical cancer screening market is expected to grow to $1.5 billion by 2020. Now, the majority of women in India don't get screened for cervical cancer, but for those that do, they're typically screened through a method called visual inspection of acetic acid, or VIA, in which a healthcare worker applies diluted vinegar to the cervix and then examines it for whitened cancerous lesions. Now, the issue of doing this in a low and middle income setting is oftentimes these healthcare workers aren't trained properly, and accordingly, we see a very low accuracy for VIA. Now, when we look at the Western world, let's say the United States, cervical cancer screening is really focused around pap smears, VIAs, or what is known here as colposcopies, and biopsies. But all of these are done by trained gynecologists. And as a result, in the US, we're catching 96% of cervical cancers in an early stage. This translates to a very low mortality rate. India shows a completely different picture, though. The primary and secondary screening method used for cervical cancer in this country is VIA, and it's done by a healthcare worker. As I mentioned before, the accuracy of this method in the hands of a healthcare worker is much less. And as a result, a lot of women who have early stages of cervical cancer are actually screened out in this process. Due to this, what we see is that a lot of the diagnosed cervical cancers in India are diagnosed at a late stage, which leads to a much higher mortality rate. Accordingly, Brandon, myself, and the other members at our team at Luso Labs are developing the CERVICAL system, which couples a portable cervical scope with a proprietary artificial intelligence, cervical cancer lesion detection algorithm through an Android application. Now, using AI, we're not just trying to binarily tell a healthcare worker or a clinician that an individual has cervical cancer or not. Instead, what we're trying to do is really inform their decision, help them make a better decision. And what we do is we highlight regions of the cervix that are suspicious for cancer. Accordingly, the healthcare workers and the clinicians can look at these areas further and be able to determine if it is cervical cancer or not. Now, one thing that we've really emphasized is learning from our stakeholders. And over the past 2 years, we've gone to India multiple times in order to understand the cervical cancer screening needs, as well as being able to optimize both our product and our go-to-market strategy in order to maximize our impact in India in the coming years. As it comes to our go-to-market strategy, we're really focusing on the development of our medical-grade prototypes, as well as acquiring our image database to train our artificial intelligence algorithm on. In addition, we are going on site visits around the world to understand cervical cancer in a global context. Next year, we already have a collaboration plan with a medical device company in India to help us with the latter stage clinical trials, with the idea of making an impact in India and other countries by 2020. Now, when we're talking about impact here, what we really want to do is to bring the clinical workflow for cervical cancer screening in India up to the same quality as the United States. That way, we can diagnose a lot of these cervical cancers at earlier stages and reduce the mortality rate due to cervical cancer. If we're able to reach the markers that we really hope to achieve, we can expect to help prevent 120,000 women from dying from cervical cancer in 2030. Now, one thing that's really been talked about here is motivation. And the motivation behind what we do is the core belief that no woman should be left behind as it comes to essential health services like cervical cancer screening. Accordingly, we're working really hard on the CERVICAL system. We've just begun a journey with many ups and downs to look forward to. Thank you all for your time. We're going to be here throughout the conference, so you can ask us any questions or provide us feedback. And yeah, thank you for the opportunity to speak today.